Hello and a warm welcome to In the Loop, the podcast where we discuss the big questions facing our health and care system. I'm Neil Dickson, former broadcaster and health leader, and as ever, alongside me in a virtual, if not a real or political sense, is Roy Lilley, another former NHS chair and a well-known, not to say notorious blogger. Hi, Roy.
Hello, Neil. Thank you for your kind introduction, I think.
Today our guest is the newly knighted Sir Jeremy Hunt. Most of you will know his background well enough. The longest running health secretary in England, who went on to chair the UK Parliament's Health and Care Select Committee. He became Foreign Secretary in 2018, ran for the Conservative leadership against Boris Johnson in 2019, and served as Chancellor of the Exchequer from 2022 to 24, briefly under Liz Truss, and then afterwards under Rishi Sunak. His time in government from 2010 and from 2012 as Health Secretary will be remembered by many as a period of austerity and low growth in health spending, but also, especially in the medical profession, for the first junior doctor strike in England, which in the end led him to impose a new contract. But his big ambition as Health Secretary was to improve patient safety, and indeed in 2022 he showed his continuing interest in the subject by publishing a book on how to cut or eliminate preventable deaths in the NHS. Well, today we're hoping to reflect with Jeremy on his time in government, but also to explore his views on the current Labour administration's drive to cut bureaucracy and waiting lists and drive through yet another NHS reorganisation. Roy, any particular angles you're hoping to pursue with Jeremy?
I think it's very interesting. When he was out of office, he had a bit of a sort of Damascenes conversion and stopped talking about hanging and flogging doctors for making mistakes and talked much more about how we could make the NHS a safer place. I think it's probably fair to say it is no safer place, even with all his well-intended efforts, and it's still a blame culture and people still try and keep out of trouble by not confessing that they've made a mistake. So I think it'll be interesting to explore that with him and the contrast with other countries. And then, of course, the other thing is how his attitude changed in that period when he was the Chancellor of the Exchequer, how he saw the NHS differently to the way you might see it sitting behind the desk in Whitehall as the Secretary of State for Health. So I think those are two really interesting areas. But of course, he's had a long career, as you said, longest serving, and there's a lot to talk to him about.
Yes, indeed. And the role of a health secretary is different from other ministers. You're trying to run the NHS. He had this newish, at the time, executive agency, NHS England, which may or may not have protected him. It was intended to protect because it meant ministers were no longer, in an executive sense, to be held accountable for what things went wrong. They were about setting policy and strategy and all the rest. But I doubt as Health Secretary actually felt he got much protection in that way, but it'd be quite interesting to hear his angle on that and how he managed NHS England.
It would, particularly given the fact that Wes Streeting has now dumped NHS England and has exposed himself much more as the decision maker in health. So he hasn't got that buffer at all. He can't stand back and say, well, they made the decision, it wasn't me. So it'd be interesting to see the contrast. And does Jeremy Hunt think that NHS England should have been, I was going to say destroyed, but done away with, I'll put it politely?
Well, that in itself is an interesting point because we see the vitriol that is thrown at politicians, and it must have some effect. They are human beings going through that. And certainly the degree of animus towards him personally when he was Health Secretary must have exceeded anything he received in any of his other jobs put together.
Yes, and I remember during the junior doctors' strike, the first one, I did a lot of vox pops on the front line. Some of it I just couldn't broadcast. They were really horrible and mostly ill-informed.
I think that's right, and not to be over defensive of him before he even appears with us. But certainly when I was at the GMC, it was clear to me that many of the junior doctors, whether they were right or wrong about the contract, they didn't really understand it at all.
No, they had a chant. I can't remember exactly what it was, but it was something is not fair. And I forget now what exactly it was they said. But I remember saying to them, well, what is not fair about it? And they didn't really understand what it was, but they just knew, they just hated the idea of a Conservative Secretary of State for Health. Well, listen, he's had a very interesting career, and I think we're going to have a very exciting 30 minutes.
Okay, let's welcome Jeremy. Jeremy, welcome. I wonder if we could start by going back in time when you were first appointed as Health Secretary and how you viewed that. I mean, given both the economic context and the fact that Conservative health ministers often view this as a poisoned chalice.
Well, it was absolutely terrifying. I mean, remember, I was actually at the time responsible for the Olympic Games. So I'd gone along to the wonderful sports festival that London 2012 was. And I don't think I'd given a single speech in Parliament on health policy, apart from very specific things to my own constituency. And this is the kind of weird magic of democracy, if you like. But, this person who knew absolutely nothing about health was suddenly responsible for the largest healthcare system in the world, employing 1.4 million people, which frankly was in a lot of turmoil after the Andrew Lansley reforms. It was quite a daunting moment. But it was also a huge privilege because you did have this sense that, not that the Olympics didn't really matter, but nothing matters more than health, does it? And so I knew that I was doing something that was absolutely central to people's lives. But yeah, it was terrifying, no question about it.
It is a different sort of job as a health minister, isn't it? In the sense that you're actually running an executive agency. You, of course, had NHS England in between you and the NHS, but you were still directly responsible for services in a way that at least some other departments are not.
Yes, and everything is your fault, compared to other jobs in government. What was it Nye Evans said about, the sound of a bedpan echoing down the corridors of Whitehall? There was a very strong sense that when something goes wrong in your local hospital, you hold the health secretary to Parliament to be accountable for it. So, yeah, it is very, very daunting. And I think that it's also very difficult for doctors. They give their life to medicine. They train for, 11 years to become a consultant. And there's this complete new boy in charge of them who doesn't know anything about it at all. I mean, they're very patient, doctors are, but you could see that sense that, what have we got this time sort of thing. So not easy at all.
I mean, the Lansley reforms were chaotic, as you say. But the one bit of the Lansley reforms that I always agreed with was NHS England. I thought, the idea of making it extant, just arm's length, to take it away from the political pressures was not a bad idea. How did that work for you, having been Secretary of State in departments where you have a more sort of direct power, really, not purview, but power, certainly. How did you find that?
Well, I think Wes Streeting might want to be careful what he wishes for, because I actually thought that did work. And I had a very good working relationship with both David Nicholson and Simon Stevens, the two NHS England chief executives that I worked with, although in the time of David Nicholson, it was still called the NHS Commissioning Board. So what I found was that it depoliticised a lot of decisions. So I think in my time as Health Secretary, I hardly had any controversial reconfiguration decisions, a downgrading of an A&E or of a maternity unit to midwife only, or whatever the kind of decisions. We had the centralisation of stroke care in the hyperacute stroke units, for example, which could have been really controversial because people were having to travel for much longer to get their stroke seen to, but actually much better survival rates as a result. And all that was taken off my plate. I'll give you another example. Simon Stevens did all the negotiations on drug prices with drug companies. So I didn't have to do any of that. It's a huge deal, and it was a big political hot potato, but it never came near me. So I thought that system worked quite well. But, I also understand why Wes Streeting has done what he's done. And I think there was an element where NHS England had kind of found a way to extract money from the government without the government ever being able to say no. And so I can sort of understand why Wes Streeting wanted to get back more control. But as a general rule, I think the NHS needs less politics, not more politics. And, he is taking a big risk.
I think he is too. During your period, you made a big focus. You didn't have any money to do anything, I suppose, but you had a big focus on patient safety. Do you think the NHS is any safer today than it was then?
I do, but I think we are backsliding a bit now. I can look at some of the things that changed. Obviously, it's really difficult to be objective about your own record, but I'll try. I mean, I think when I became Health Secretary in 2012, if you cast your mind back, we had a lot more covering up of poor care in the NHS than we have today. There is much more openness and transparency. We have the CQC that goes around doing that. I set up the system where hospitals are graded as outstanding, good, requires improvement, or poor. And I'm sure there are flaws in that system, but by the end of my time, 4 million more patients were being seen in good or outstanding hospitals. And actually, the one I was most proud of, the number of baby deaths was down by 15%, which meant there were 2 fewer babies dying every single day across the system than when I arrived. And there was a huge focus on maternity safety. So I think we did make some progress. There were areas where I also didn't make progress, like on A&E waiting times, elective care waiting times. Those I really struggled with, mainly because of the financial constraint. But on safety and quality, I am worried that since the pandemic, it's been going back the wrong direction. You can look at the baby death rates, and they are still not as good as they were in 2018. And so, as we now, once again, sort of history repeating itself in a way, focus on bringing down waiting lists, I think we've got to be really careful not to fall into the mid-staff's trap, where, as David Nicholson used to say, people hit the target and miss the point.
The other point, it seems to me, is that it's the regulatory burden on the NHS and on the individuals, clinicians particularly, where they find it, they mess up and they fess up, the roof comes in on them. And getting to a no-blame culture, again, like Sweden, New Zealand, I think in Japan as well, we look after over 1 million people every day. Not all of them are going to go home happy bunnies that they've had a terrific experience. And some of them may well have something done that's wrong, or by accident or mistake or overlook or what have you. It's just impossible to think everything's going to be perfect 1 million times every day. We must find a way to take that regulatory burden off the shoulders of the clinicians. Did you think about that when you were in pursuit of a safer NHS?
A lot. And Sweden's a very good example because, if we had the same baby death rate as Sweden, 1,000 more babies would live every year than they do with the NHS in England. And one of the reasons is because when you have a baby death or a baby is born with cerebral palsy or disabled in some way, what happens in Sweden is that the hospital only has to say there was a mistake, doesn't have to blame any individual, but it just has to say there was a mistake, and automatically the family get compensation. Whereas what happens in England is, lawyers get involved and, there's litigation. If it's a disabled child, it can be millions of pounds at stake, and it can take 7 years before it's all resolved. And of course, the one thing that doesn't happen in that period is the thing that most doctors and nurses want more than anything else. And by the way, most parents want more than anything else, which is to make sure you learn from the mistakes so that it's not repeated. And those legal processes stop the learning. And, I'm a big fan of what they did in Japan, where about 15 years ago, they introduced automatic payment for babies born with severe cerebral palsy. So no legal cases, you just get automatically paid. And the result is they have reduced CP cases, severe CP cases, by 1/3 in Japan. So that is saving a lot of lives. That is reducing a massive financial burden on the system. And it's reducing massive heartache for families. And I think that's what we have to tackle. I still think there's a long way to go on that, getting towards that no-blame culture.
Why do you think you were not able to introduce that kind of legal reform? There are obviously lawyers on the one hand who are definitely got a vested interest. Certainly many in the disabled movement would say this is simply an attempt to try and take away our rights to get compensation. I think I would absolutely agree with you. The current system is unsustainable. The amounts being paid out look huge, and the effect is a negative one. It actually leads to a less open culture, which means more harm.
Well, I absolutely did start the process. And I had, particularly when we had the Bauer Garber case, I got an independent review done by Norman Williams, who was previous president of the Royal College of Surgeons. And I started discussions with the Ministry of Justice to talk about what we could do to overcome resistance from the legal community. And by the way, I'm hoping to make some suggestions to Wes Streeting for him to do this. By the way, it was also something I looked at when I was chancellor, but we got timed out by the election. But I think it is absolutely the next step. And the interesting thing is, there's a good example and a bad example here. The good example is New Zealand, which introduced no-fault compensation. Now, when I was Health Secretary, the Department of Health said, we can't do that here because it's too expensive, because what will happen is if you have no-fault compensation, you end up giving compensation to lots of people who don't currently get it. It turned out when I was chair of the Health Select Committee and I wrote to the department and asked for the numbers on this, that actually the overall litigation compensation cost the New Zealand system less than it costs us here as a proportion of total healthcare spend. So their no-fault compensation system saves them money. That's the good example. The bad example is that I think it's got a whole lot worse in England since we introduced no-win, no-fee lawyers, and they've just done that in Scotland. And up until the point that they did it, you could see that actually the Scots were spending far less than the English NHS on compensation payments. But I'm afraid now it's going to go the other way in Scotland.
That's really interesting about not getting the right information from the civil servants. Can I dive into you moving across to the Treasury? First of all, as Health Secretary, how difficult is that process of trying to get money for the NHS and indeed social care? Because there's a lot of criticism that not enough was done to try and get social care money. And then how different does it look when you're in the Treasury?
Well, it looks totally different. But first of all, when you're Health Secretary, I literally a month before I was moved to the Foreign Office, working with Simon Stevens, I secured a 20.5 billion increase in the annual NHS budget. And I definitely wouldn't have done that if I hadn't been in the job for 5 years and really understood how Whitehall worked. And I realised that number 10 and number 11 just wouldn't believe the Department for Health if we said the NHS needs more money. They'd say, well, you would say that, wouldn't you? That's what all departments say. So I got the Cabinet Office under Jeremy Hayward at the time to do a Cabinet Office assessment of how much money the NHS actually needed. And they concluded, as we knew, but they concluded themselves that the NHS needed about 3 to 3.5% annual increase in real terms funding in order to keep pace with demand. And I got that commissioned, and that was the crucial thing that persuaded Theresa May that this needed to happen. And so that was how I was able to negotiate it with Philip Hammond. And, that was a big thing. And I was absolutely determined to do the same thing for social care. But unfortunately, I then got moved on and various other things happened, including actually the fall of Theresa May's government. So that was that. When you're in the Treasury, the NHS just looks like a bottomless pit. They just come to you with endless requests for more money, and the bad headlines never go away. I knew this when I arrived as Chancellor, but I said to the Treasury, look, what we don't understand in the Treasury, and we need to, is strategic cost reduction. Because, what you've got to do is you've got to give the money to the NHS, but you've got to ask for efficiencies in return. And the Treasury really had no understanding of how you create efficiencies in a healthcare system and the right way to get that through. So when I was Chancellor, I did in my last budget give the NHS 3.4 billion to overhaul its computer systems. I thought this is like the one thing I can do for the NHS, actually alongside the long-term workforce plan. So those were the two big things I did for the NHS when I was Chancellor. But in return for the 3.4 billion that I gave Amanda Pritchard, she committed to the productivity plan, which for the first time committed the NHS to 2% increase in productivity every year for 5 years. Is that still going strong? Is that going to survive the dismantling of NHS England? I don't know. But that was the first attempt by the Treasury to understand that you need to, if you're thinking about this like a business, you've got to have a plan for efficiency, just like you have a plan for demand.
How do you view the current settlement?
So they got 22 billion last year for, I think that was over 2 years. Personally, I think it's a real mistake to allow nearly all of it to be eaten up in pay rises. If you're really going to tackle waiting lists, you need to increase capacity and you need more productivity from the medical workforce that you have. And this money has done neither, because there were no productivity gains in return for the money, and it's gone on pay and not on capacity. So I'm struggling to see how they're going to be able to do the volume of extra operations they need. But we'll have to see what Rachel Reeves announces in a few weeks' time.
Tell us about your thinking and relationship when you were at the Treasury and when you were the Secretary of State for Health, about the relationship with social care and how you see that going. People are talking about, well, they should be merged with the NHS, or, I mean, why? If it's funded properly, you don't need to merge it. Is there a management interface that needs to be sorted out? What's your thinking on that, Jeremy?
Well, the first thing is that this is not going to be solved by throwing a huge amount of extra money at social care, because that money doesn't exist. And Rachel Reeves doesn't have the money to solve the problem with a huge injection of extra cash. And by the way, we've got huge workforce challenges in the social care sector as well because of
1.5 million or something.
People but also the squeeze on immigration, which has been such a big source of supply. So then you've got to say, well, how do we solve the problem in a smart way that doesn't cost a lot? And the fundamental point is that a hospital bed is 500 quid a night, or more, frankly, but at least 500 quid a night, whereas sending someone round to check up on a vulnerable older person once a day is 50 quid a day. And so prevention is much cheaper than cure. And for that reason, the only way we're really going to solve this is by making sure at a local level that it is one budget shared between the NHS and local authorities for looking after that 90-year-old woman with early stage dementia. And the NHS and the social care system need to have one plan which says, what are we going to do to keep Mrs. Jones as healthy as possible and out of hospital, and move the money around to do that. And that, I think, is entirely possible, but it means dismantling the kind of targets culture that we have in the NHS, so that the NHS on the ground in Norwich or in Guildford actually can have the freedom they want on the ground, on the front line, to move resources to where they're going to have the most effect. And at the moment, that's not really happening.
I mean, do you regret not having got rid of some targets yourself during your time?
Absolutely. I wanted to get rid of all the national targets. I think they turned the NHS into the most micromanaged healthcare system in the world. Stalin would be proud of the targets there. So I didn't want to get rid of them until I'd actually was meeting the targets, because otherwise I thought people would say, well, he's just getting rid of them because he can't meet them. And so unfortunately, I never got to the point where I was hitting them. So the rest is history. But yes, that's a great regret of mine.
Could you have done more to get more money for social care? I think it was suggested by Andrew Dilnot when we interviewed him that at least one health secretary had said to him, I wish I'd pushed more, but always the fear that if you push more from social care from the Treasury, all they do was take money from the NHS.
Look, I think on the money front, I feel that the cuts to social care went too deep in 2010, and I think it was an unintended consequence at the time. But when I was health secretary, I think I think I did do a big thing in getting the extra 20 billion for the NHS, and I was wanting to do the same thing for social care. And unfortunately, I was moved on, and that is a problem in our system. But I think the whole world has moved on. Even Labour are not saying they're going to solve this problem with money. So now we need to, deal in the realms of the possible and say, how do we reform this at a local level so that resources get put into prevention, and that means resources into social care.
Just turning then to the future of the NHS in the wider sense, do you still believe the NHS will survive free at the point of delivery, or should we be looking at different funding methods given all these current pressures and what's coming down the road in terms of defence, such as social insurance, which some would argue seems to work rather better in Europe?
Well, I think it's a red herring. For sure, the social insurance systems in places like the Netherlands, Israel, they do deliver better health outcomes than the NHS delivers today. But we are never going to make that change in this country. No political party is ever going to persuade the British people that we should have a system where everyone gets bronze level insurance, but people with money can upgrade to silver or gold level insurance, which is what you have in those countries. And I think a much better question to ask is, how can we, with the structures that we have in the NHS, get our standards to be as high as in social insurance systems in continental Europe and countries like Israel? And I think we need to look at what happens in Sweden. Second time I've said that today, because in Sweden, they have broken the NHS up, their equivalent of the NHS up, into regional blocks. So it's operates in a smaller set of sub-regions rather than one big national organisation. And I think, first of all, that depoliticizes it at a national level, doesn't dominate general elections in the way that it dominates general elections here. But also, I think that local autonomy just means that there's much more flexibility, there's much closer working between the health and the social care sides of the system. And I think that has worked. We've kind of done that with the police. Police are now not directly accountable to the Home Secretary. We used to have, the Home Secretary used to come to Parliament, report on the burglary statistics for the last month. Michael Howard would be grilled by MPs when he was Home Secretary. And now the police report either to the local mayor or to the local police and crime commissioner. And since that happened in 2010, non-computer crime has halved. So I think it's actually broadly worked. I mean, things aren't perfect with the police, of course, but on the whole, I think police forces would say the new system has allowed them to get on with the job more effectively than when they had to worry about endless Home Office targets.
NHS run by mayors?
Possibly. I think actually
Boris wanted that when he was in London. He wanted
I could see the logic for that. Particularly now we're going to have mayors covering everywhere because of Angela Rayner's reforms. I just feel at the moment that centralisation is what everyone thinks is the answer to everything. And I think it's made the NHS into a kind of tractor factory system of which Stalin would be proud. And it's actually at the heart of the reason why it underperforms given the amount of money we put into it.
And would you bring social care under that as well, under those mayors?
I think quite possibly. I mean, the social care is going to be the responsibility of unitary authorities, and everywhere's going to have unitary authorities in a few years' time. So that would be a really good opportunity to bring the two together.
We could trial it now, couldn't we? Do it in some places where they've got strong mayor presence, see how it works. I just want to ask one quick question, because I know we're up against the buffers of time. What was it like when you stopped being Secretary of State for Health and became Chancellor of the Exchequer? How did you sort of do the Jekyll and Hyde bit?
Well, to tell the truth, no job I've done in politics has the emotional punch that being Health Secretary has, because you're dealing with life and death situations the whole time. And here I am talking about the NHS 6 years on, and frankly, I may have left the NHS, but the NHS has never left me, and it's something that will be with me for the rest of my life. But being Foreign Secretary is a lot of fun. You travel around the world, motorcycle outriders, red carpets. You live the life, meet fascinating people like, President Trump I met several times. And the thing is that when you're Foreign Secretary, nothing is ever your fault. You're talking about what's happening in Yemen or Saudi Arabia or India or China, and there's a bit of hand-wringing, and, we call on this government to do this and that government to do that, but it's not your fault. And that, after being Health Secretary for 6 years, when everything is your fault, that was quite a relief.
Did that affect you personally, Jeremy? The kind of criticism which was pretty harsh during the time you were Health Secretary. And I think in the junior doctors dispute, which I was involved with at the GMC and personally got some criticism, but nothing like what you got. Did that affect you personally?
It was, probably the toughest period of my entire political career. And, I take the view that if you can't stand the heat, get out of the kitchen. That is part of what politics is about. And I care far more about what people say about me in 5 years' time when I'm long gone than what they said about me at the time, because you're always going to get criticised for change. But, what kept me going? Well, we've talked about patient safety. That was what I was focused on. And I just hung on to that. But for sure, it was pretty tough. And do I feel vindicated? Look, there's always more to do on patient safety. But here's the thing. We're talking about patient safety now. I think that when I became Health Secretary, most people never heard of patient safety. So I think it has become much larger in people's thinking. And I do think that's a good thing.
Well, we've probably run out of time. Sir Jeremy Hunt, thank you very much for giving us your time and such an interesting insight to your time in the big jobs. Thank you very much.
Thanks, Roy. Thanks, Neil.
Okay. Well, that was interesting. We covered the ground, and I think he was very frank.
I think he was, and it was interesting how he views the different posts that he's held in different ways. I think he did go through more of a Damascene conversion than he said, but he absolutely did recognise at a relatively early stage. Very difficult, I think it's probably too close to judge him now. He talked about the extra 20 billion that he got. One tends to think that it's him and Simon Stevens who managed to get it. I don't know whether
they were a good team.
Lies.
I think they were a good team. The thing is, at the time, 20 billion was a huge amount of money to be dropped into the NHS, and it did save its bacon. Now, 20 billion, it's gone on increased costs of junior doctors, national insurance uppages, inflation, and the cost of doing more waiting lists.
And the reality, which again, you can't really blame him for unless you say, well, he's a Conservative and they introduced austerity. But the reality is that over that whole period of time, the NHS level of funding was well below what the NHS had needed in order to survive. And for large periods of the NHS, it didn't even achieve that.
No, 10 years of austerity funding under George Osborne after the world banking crisis, that did the damage then, and we're still suffering with the legacy of it this time around. Well, listen, it was really interesting. It was very frank. It was a classic when he said, when you're foreign secretary, you don't get blamed for anything. When you think of the damage that some foreign secretaries have done back in the early days of parliaments and wars have been fought. But it was a very interesting, it was a good guest. And I hope if you're listening, you enjoyed being with us. And thank you. And from me, Roy Lilley, and from
me, Neil Dickson.
Thank you. We'll see you next time. Bye-bye now.